So my job today is kind of to go back through and summarize the symposium that was held last fall, November. The venue was Atlanta, Georgia. The title of the symposium was Antibiotic Use and Resistance, Moving Forward Through Shared Stewardship. I think this was the 4th symposium total. Okay, so we've been doing this for a while now. And for those of you that weren't at the symposium, it was 2 days roughly, broken up into 4 sessions. Session 1, the title was Identifying and Prioritizing Key Resistance Issues at the Human-Animal Interface. Session 2 was titled Stewardship Programs to Minimize Resistance. Session 3, Metrics of Success to Minimize Resistance. And then Session 4, where there was no official title, is kind of Strategies or the Way Forward, I think is maybe what that was titled. But we heard from folks from the USDA, the FDA, and a little bit about international activities. And the format of the summary, or the symposium, was each session started with a cadre of speakers. So we had 3 to 4 speakers in each group. And then we would go to breakout sessions for the audience, facilitated breakout sessions. There were a number of questions that each facilitated group was to go through or walk through and to kind of come to some consensus. Those were then brought back together into what made up our kind of what was the total of the white paper. So that was the format of the symposium. I'm going to stick specifically with the survey results. So the survey was administered, I think it was in January is actually when the survey came out. Following the symposium, we had 187 registered attendees at the symposium. We had 27 people complete the survey, so it was a fairly typical survey response rate of about 15%. But keeping that in mind, the survey had, I think, approximately 15 questions. The first question was, what was the key takeaway from the symposium? And I have taken a little bit of writer's liberty with some of the responses, but I tried to summarize them when there were common themes among those responses so that we get kind of the big basic concepts and use this to help us move forward with planning the next symposium. So there were comments that were, the One Health approach was kind of the key takeaway. Several comments were made about the dialogue and how good the dialogue was, and you'll see that through the other questions too. That's a pretty consistent theme. It was good to hear from both sides. I think it was mentioned at the lunch meeting today that we had more participation from the human medical community than we had in previous symposiums, and I think that was well received. And then there were other comments made as far as the key takeaway that antibiotic resistance is a complex issue and there's no simple solution. So there were kind of the free-form comments. The second question was, what's the most valuable part of the symposium? And again, the majority of those 27 comments, when they made a comment, was that the interaction or networking or hearing from both sides, human and agriculture, putting those two things together in the same room was very valuable. And I think along with that, the breakout sessions were a good part of facilitating that. I didn't mention it earlier, but the breakout groups were not consistent through the symposium. And so the breakout group that you were assigned to in day 1 would be a different group on day 2 and a different group on day 3. So there was lots of blending and mingling. And then there were comments about the most valuable part was the combination of presentation and breakout. And I think that actual comment, if I remember it correctly, was having the presentation set the stage and then having the breakout groups continue the discussion in a smaller, closer venue was valuable. And there wasn't a specific response listed this way, but a lot of the attendees or of the people that completed the survey felt that the venue, and they mentioned specifically the connection to the CDC. We did have a lot of participation with CDC, also with FDA and USDA, so there were a lot of regulatory participation as well. So I think those were all good things about the symposium. What did you like least about the symposium? I've lumped the first 3 together because the breakout sessions were cited as the most important, or one of the most important things about the symposium. They were also the things that they liked the least about the symposium. And I think if you just kind of put those together, the short version is maybe we need to look at ways to moderate those a little better, facilitate those a little better. I think a lot of those are just natures of breakout sessions. Somebody mentioned that they were too long. Well, I was in several breakout sessions where there wasn't enough time to discuss all the questions we had. We had 1 or 2 individuals dominating some breakout sessions. I think that happens naturally. So looking at ways we can facilitate those, I think we'll move those forward if we continue to use that kind of format. Several of the survey respondents said that there was a lack of opportunity to ask questions of the speaker. We've done that both ways in previous symposiums. I know there are symposiums where there were opportunities to ask questions of the speakers. This one we did not. They came in, they gave their presentation, set the stage, and I think the thought was that the questions could be answered or asked in the breakout sessions, and I think a few of the respondents are telling us that maybe not exactly, that didn't happen exactly the way we wanted. And there were also a couple responses, and they didn't use this specifically, again, this is my literary license, but that several of the attendees felt like antimicrobial resistance, or maybe where the symposium was kind of a new topic to them. And so they suggested kind of a refresher session, a beginner session, or I listed it as a 101 session. So, maybe it's time to go back and revisit some of the things we've already done, or catch people up to speed as far as where we are, so that they can participate a little more fully as the discussion continues from the first to the second to the fifth, and hopefully 4 on symposiums. Question 4, what's the one thing you would have changed? And again, they're very much aligned with what did you like least about the symposium, is the opportunity to interact with the speakers, and then, again, facilitate the breakout sessions a little bit better. I think that, again, the response rate, 27 out of 187, we have a small group of people talking to us, but they're saying the same thing. So I think that's something we need to pay attention to as co-chairs and organizing committee. Okay. So these, you'll see a series of graphs, and they're all asking essentially the same question, but it's by session. So I told you there were 4 sessions to the symposium. We're asking the same question. Was the goal accomplished for that session? The first session, again, was to focus on the key antimicrobial resistance issues at the human-animal interface. You can see there, most of the respondents agreed. I think one of the presenters in this session was excellent. That was me. It was a joke. But you'll see that they felt like our goal as far as focusing on those issues was accomplished. And so I think, those are the things we need to look to. Maybe having small sub-goals within a larger symposium that people can come in, okay, here's what we're talking about today, and move forward. The second session was on covering stewardship programs that exist, and it was both animal and human health. And was the goal accomplished to better understand those? Again, the agreement's pretty high. We had one person, I think, that disagreed that we accomplished that goal, and somebody that didn't have an opinion. The actual free-form comments that were listed, one of them was that the topic needs to be continued in the future. And the second one were that the lectures were very good. I think they actually were fabulous, but actual take-home programs were lacking. Because that also blends with the results we got for the third session, which was better understanding what metrics most likely need to address or will address the issue of antimicrobial resistance. The agreement wasn't as high, and I think this session 2 and session 3, which this is session 3, the theme was kind of consistent among the survey respondents. Generally, they agreed. The comments here was that there was less agreement, and they mean between the two sides, human and animal health. Session didn't get down to addressing specific metrics of antimicrobial use, and one commenter said that this was a hot topic that needs to be hammered out. I think those 2 sessions are actually saying the thing, not that the topics were necessarily too premature, but a lot of the stewardship programs that are in place, a lot of the metrics that were discussed are very, very early in development, or even just in the planning phases. And so I think attendees that came to the symposium that were wanting to go home with the meat of a program designed that they could implement on Monday, they didn't take that home. And I don't know that that was a specific goal of our symposium. It was really more just to get people talking about what's out there, recognizing that there's very little out there. So maybe they're on board with us now that there's little out there. So the fourth session, again, that was kind of the regulatory aspect. What are the strategies from the FDA, USDA, international activities? Was a goal accomplished to better understand those activities? It's very much matches the last graph on metrics, and I'll sum up this is my take on the overall comments. This topic, again, may have been just a bit premature because of the stage of where those programs are at and the audience's expectations as far as taking home an actual program. So were the breakout sessions valuable in understanding the perspectives of others regarding antimicrobial use in food animals? The agreement is strong, and it matches up with the comments as far as people like the breakout sessions, with a few key points that I think as a committee we need to potentially address in the future about the formatting. were the breakout sessions valuable in understanding the issues surrounding antimicrobial resistance in animal agriculture? Again, the comments aren't linked, but the numbers are the same, probably have the same people saying the same things. But very much strongly agree that yes, they were valuable. So we asked the survey respondents to kind of help us plan for the next symposium, and basically asked to build on our efforts between ag and public health. What should we look at for future meetings? And the themes that were repeated, there were others that we had kind of one or two responses in that way. One was, where can we get an update on progress? Where are we as far as progressing, as far as developing stewardship programs, monitoring programs, those kinds of things? Can we get some information about building a national strategy? And I think the one that we kind of took to heart were metrics and benchmarks, because that'll be the focus of our discussion today. And then there were a few comments about education and outreach. And if you need specifics, I can look up those and I can give you the actual what the comments were. Specifically, the education, a lot of the education and outreach was from the animal health perspective, reaching out to public health or human health. And I feel like a lot of the respondents, and certainly a lot of people that I've talked to, felt like this meeting was a good one in that regard. So I think we've made some progress there. One of the other questions in the survey, I think this is the last question I'll touch on. How did you learn about the symposium? And I don't know if you can read that or not, but the majority of people that came to this symposium heard about it from a colleague or a coworker. A few from previous meetings, several from direct emails from the NIAA, and then we get down to news releases, websites, and a few others. But the majority of people are hearing about this symposium essentially from word of mouth at work. And so for me, and I'll wrap this up, I think going forward again, because that was the topic of our last symposium, things that we should pay attention to as co-chairs and as an Antibiotics Issues Council, specifically from the survey, I think we should consider, I put the same, because that's what the survey respondents said, that the connection with CDC was good. I think probably the more of the heart behind that is we need to be connecting with our regulatory agencies. I think there was a lot of good things that came out of that, and so having this in venues that are convenient for them to attend, I think, is a positive for the symposium. I think we should consider an antimicrobial resistance 101 session, maybe combine that with previous symposium highlights, and that comment and our increasing advertising efforts. Again, a lot of people are hearing from this by word of mouth, and so I think there are ways we can get this out to more. And if we want more people to attend, we get more people to attend, we're going to have to spend some time to catch them up with the issues and spend the time to educate them. One thing that I hadn't really thought about until I looked through the survey, I'm a science person, and so a lot of this stuff I can pick up as the speakers go. But we have a really diverse audience that attends this symposium. We have a lot of scientists, but we have policy folks. Not that they're not intelligent, but they certainly don't live in that world. We have a lot of producers. We have pretty much the whole gamut of folks that attend our meeting. And so I think it would be beneficial for us to spend some time going back over that and catching those people up to speed, certainly with what's been discussed at the previous symposium, but there were some strong comments that just getting more information about antimicrobial resistance as a whole would be a good thing. And then the formatting changes to the symposium based on the survey, I think those are minor things. Maybe we should go back and revisit the opportunity to ask questions of the speakers. Somebody will probably complain that took too long last time. So I think that's a little bit of a moving target. But I think using the speakers, not just the information, but being able to ask more specific questions, I think that in itself would improve breakout sessions. Maybe shorten the breakout sessions a little bit, find ways to better facilitate the breakout sessions. Again, I think those are fairly minor formatting changes. Overall, the symposium was well received. I think it was well done. The information was timely and good. So that's all I have. In following my own recommendations, I would be happy to take questions. But I think that kind of leads us into our discussion of where we want to go in the future for future topics.